Hi, my name is Rob. I'm a student physical therapist at Rocky Mountain University. Today I'm going to be demonstrating how to do E-stim with the TENS unit. Our patient is a 36-year-old female. She recently had an onset of back pain after picking up her child out of her crib. She is about 4 months postpartum, and this pain has been bothering her for 2 months now. So I've chosen to use TENS for this. And we're going to do burst modulated pulse current TENS for this. Some indications for E-stim: chronic and acute pain, muscle re-education, muscle atrophy, muscle strengthening, increasing range of motion, decreasing edema, decreasing muscle spasms. For today's purpose, it's totally for pain. So we're treating pain in our patient. So some contraindications we want to be aware of as well with E-stim. Since we're working with a female patient, we want to be certain that they're not currently pregnant, or if they have any history of miscarriages, we want to make sure we verify that with them. We also want to make sure that they don't have any implanted medical devices such as a pacemaker, they don't have any skin infections, they don't have any active cancer, impaired cognition, DVTs. We want to make sure we don't put the pads on the reproductive organs or the eyes or the anterolateral neck where carotid bodies are. So I'm going to go ahead and introduce myself to our patient. How's it going?
Doing good. How are you?
Good. Hey, we're going to go ahead after treatment. It's after treatment, so we're going to go ahead and do some E-stim. Does that sound good to you?
Sure.
Okay. This is going to help with your lower back pain as we send you home. And kind of the purpose of the TENS unit, the burst modulated pulse current that we're going to be dealing with, this is going to help you have zero pain for 4 to 6 hours once you're home. So you kind of have a break from that. Does that sound good?
That sounds great.
Awesome. Is it all right if I pull your shirt up a bit, put the pads on?
Yeah.
Okay. So as I put the pads on, I'm going to go ahead and examine the patient's skin, make sure everything looks good. And everything looks good there. I'm going to go ahead and put our pads on. Okay, now we've got our pads on. I'm going to go ahead and look at our settings. So, burst modulated biphasic pulse current. It's going to have the same, kind of like a mix of high volt and low volt. So we're going to have a pulse width of 2 to 400 on our TENS unit. We're going to have a rate of about 100 PPS. So these are both pretty high, so that's kind of the reason behind the burst. It's not going to be a continuous current. It's going to be in bursts of 1 to 4 hertz for patient comfort. And this is going to work via the endogenous opioid theory, and that's why the pain relief will last so long. So I'm going to go ahead and get this plugged in.
Are they really? Yeah. I was thinking mine were pretty sticky.
Okay, and for this, I want to make sure that there's no accommodation or that these motor nerves don't get used to the signal very quickly. So I'm going to ramp it up a little bit fast, but still at the same time make sure that our patient is comfortable. Okay, I'm going to go ahead and turn this up. Let me know when it feels good to you, okay?
Okay.
We want to make sure that we have a muscle contraction that is visible while we're doing this. So go go ahead and start. Doing okay?
Yeah.
So I've got the patient laying down, and we're just going to put the pads on his knees.
Okay.
So
Got a visible
obviously,
contraction
two
there.
different channels
I'm
going
gonna go
inside
ahead and lay this pad
So you
flatter.
want pads on the same channel and be diagonal from each other.
And normally we would do this for 20-30 minutes. For today's demonstration purposes, we'll just leave it on there for about 30 seconds.
Right in the middle.
Does that feel okay?
Yeah.
IFC,
Tingling, yeah.
trying to get pain relief from the jet control theory. So pain relief should really last super long, but still has some benefit.
Okay, so it's been about 30 seconds. Go ahead and turn it off. I'm going to go ahead, unplug the pads. While I'm doing so, I'm going to check the patient's skin. Make sure there's no electrical burns.
And then I've already got the intensity set, so I'm going to go ahead and hit start. And then I'm just turning up the intensity a little bit. Let me know when you kind of start feeling it buzzing, tingling kind of feeling.
Okay, and our patient's skin looks good. So we'll end treatment there.